Against COVID-19, I want to reassure the people of Ontario. The plans for our economic recovery are well underway. It's critical that we keep people safe, at the same time that we keep Ontario open for business and as many people working as possible. To date, our government has introduced several pieces of legislation that lay the groundwork for a strong recovery for our province. We passed the Building Transit Faster Act to help reduce delays and accelerate our historic $28.5 billion subway plan for the GTA. We passed the COVID-19 Economic Recovery Act, which allows our government to build highways faster and enter into innovative partnerships to build transit-oriented communities. And this afternoon, our government introduced the all-new Ontario Rebuilding and Recovery Act. The bill includes a package of measures that, if passed, will help provide more tools to accelerate more types of projects, including GO Transit projects, additional transit-oriented communities, long-term care homes, hospital and healthcare facilities, broadband expansion, and highways. We're taking key components of previous pieces of legislation for subways and highway projects and using those same provisions to help get shovels in the ground faster on everything. I'll let Minister Mulroney and Minister Surma share the specifics in a moment, but I want to focus briefly on broadband. It's critical we get reliable and faster broadband to the many underserved communities across Ontario. Last year, our government committed $315 million over 5 years to expand and improve internet and cell service in more underserved communities. The pandemic has shown how absolutely critical these services are for millions of people and businesses. We need to help bring more businesses online, bring more online learning to students, more convenient virtual care to patients, and so much more. As part of today's initiative, we're looking at ways to remove barriers to broadband expansion so we can get more people and communities on the internet and cell service they need, so they can carry on with their everyday activities, whether it's banking, shopping, or watching a movie. High-speed internet and cell service are also critical importance to ensure more Ontario businesses can reach new customers and markets. Our ambitious infrastructure plan also requires a strong, skilled workforce. We're investing over $43 million into apprenticeship and pre-apprenticeship programs to attract more young people to the skilled trades. We're investing another $37 million to help more than 15,000 people train for new jobs and upgrade their skills so they can contribute to the province's economic recovery. We have to train the welders, electricians, plumbers, and construction workers we need now to build the roads, bridges, highways, transit, and long-term care homes we need for the future. For the young people listening out there, I know you're worried about the economy, the skilled trades. They offer a well-paying career for life. And we're going to need the help of every skilled tradesperson. Today, we're taking steps to create a skilled trades and professional workforce pipeline for these projects. Through the investments we're making this year, we will increase apprentice registration and training opportunities through these major infrastructure projects. Today, we're laying the foundation together to build Ontario's future faster, on time, and on budget. This approach will benefit everyone in every corner of our province today and well into the future. Thank you, and God bless the people of Ontario. Now I'll pass it to Minister Mulroney.
Thank you, Premier Ford. The COVID-19 pandemic has created unprecedented challenges. It's had a devastating effect on our economy. Canada's GDP is forecasted to shrink by 6.6% this year. The good news is that we are recovering, with employment up 168,000 in September, building on 670,000 over the previous 3 months. But the road to full recovery will be a long one. The Premier often says that this pandemic has revealed the Ontario spirit, and I couldn't agree more. People and businesses across this province have gone above and beyond to help and support each other. And our government is determined to do our part by creating jobs and getting Ontario back on the path to prosperity. It's time to get Ontario building. Our government has a 10-year, $144 billion infrastructure plan. But we need to cut red tape so that we can realize the economic benefits faster and effectively stimulate our economy now. For every $100 million that we invest in public infrastructure, real GDP is boosted by $114 million. Our 4 priority transit projects in the GTA are expected to support up to 20,000 jobs during their construction. It's time to expand that sort of job creation to other parts of Ontario. We need to build infrastructure that will connect our cities, improve our quality of life, and brighten our future. Highways, transit, long-term care facilities, broadband. These are the investments that will make a difference in the lives of millions. But all too often, burdensome red tape delays these kinds of projects. This frustrates people and it hurts our economy. The COVID-19 pandemic has made addressing those delays even more urgent. Les autoroutes, les transports en commun, les établissements de soins de longue durée, les services à large bande. Ce sont ces projets qui feront une différence dans la vie de millions de personnes. Mais trop souvent, des formalités administratives lourdes retardent ces types de projets. Cela frustre les gens et nuit à notre économie. La pandémie de la COVID-19 a rendu la résolution de ces retards encore plus urgente. Minutes ago, I introduced the Ontario Rebuilding and Recovery Act 2020, that, if passed, will cut red tape and remove barriers in the planning, design, and construction processes for major infrastructure projects. Accelerating the delivery of these projects will boost our economy and help put more people back to work faster. Il y a quelques minutes, j'ai présenté le projet de loi de 2020 sur la reconstruction et la relance en Ontario qui, s'il est adopté, réduira les formalités administratives et éliminera les obstacles dans le processus de planification, de conception et de construction des grands projets d'infrastructure. L'accélération de la réalisation de ces projets stimulera notre économie et aidera à remettre plus de gens au travail plus rapidement. Like the Building Transit Faster Act, which came into force earlier this year, these proposed measures are intended to be backstops to prevent significant delays if we are unable to reach an agreement with our partners. We are committed to collaborating with our municipal partners, Indigenous communities and organizations, and the private sector. Together, we will make Ontario more competitive, strengthen the skilled trades workforce, and build healthier, safer communities as we work towards a brighter economic future. Thank you. Je vous remercie. I'll now turn it over to my friend and colleague, Associate Minister of Transportation, Kinga Surma.
Thank you, Minister Mulroney. People are relying on our government to guide Ontario's recovery from the COVID-19 pandemic. Our government has a plan to help stimulate our economy, rebuild Ontario, and get people back to work safely. Our plan includes the acceleration of construction on significant infrastructure projects to kickstart our economy and create opportunities for communities and businesses in every corner of the province. This means we'll build highway projects faster to reduce congestion and improve the movement of goods, including medicine and food. It also means that we will be able to build complete communities around an ever-expanding network of public transit through our TransitOriented Communities program. This legislation, if passed, would amend the Building Transit Faster Act and the TransitOriented Communities Act, extending the authorities granted under both pieces of legislation for a new subway plan for the GTA to other provincial transit projects. These amendments would allow our government to delegate authority to Metrolinx and other public bodies to enter into new types of arrangements for transit-oriented communities as a part of new transit projects. The pandemic has highlighted the importance of living within walking distance of services and allows us to address other shared objectives like affordable housing. Since our government announced our intention to make transit-oriented communities a priority, the response has been tremendous. Some municipalities are already taking steps to work with us and Metrolinx to make transit-oriented communities a reality in their neighborhoods. Durham Region and the town of Innisfil are two great examples. If passed, the Ontario Rebuilding and Recovery Act 2020 gives us the tools we need to clearly and quickly communicate to municipalities and potential partners to speed up the delivery of transit-oriented communities. We are fully committed to working in collaboration with municipalities to achieve these ambitious projects. Our government is charting a path to recovery that gets people back to work and strengthens communities across the province. The sooner we get moving on these significant infrastructure projects, the more jobs and economic benefits we'll see as we build smarter, healthier, and safer communities. Thank you.
We'll go to the phone line for questions. First question, please.
From Graham Richardson at CTV Ottawa. Please go ahead.
Hi, Graham.
Hi, Premier. I
Hi,
just
Dave.
wanted to ask you about, we have a local restaurateur here saying, and I'll just read you this, he's tweeted out, he owns 2 restaurants. 2 weeks since being shut down, promised help from Ford Nation and Justin Trudeau. We've seen nothing. My restaurants are paying full rent, full hydro, receiving minimal support. What do you say to him and others who haven't seen or heard anything?
Well, I'll be very, very clear on this. We're taking care of all the hydro costs. We're taking care of all the municipal taxes. He's allowed to sign up for the $60,000 loan, which 30,000 of that's going to be a grant. He has the ability to get 65% of his staff paid. But I understand nothing's better than keeping the doors open. I get it. You know, my heart breaks for these restaurant owners and especially the small, not the massive franchises. They're hurting, but these small businesses. And we're doing everything we can to get through this. When I spoke to our chief medical officer the other day regarding these restaurants, or one doctor on the health table, I should say, said, thank God we did what we did in Ottawa because they were going over the cliff. And you know, they're now we're seeing a little change, a little positive news in Ottawa, but we have to be vigilant. And I understand where he's coming from, but again, his rent will be paid. I forgot to mention that 90% of his rent's going to be paid. He won't be kicked out of his restaurant if he's leasing. And we're throwing every fixed cost to take care of through the province as we possibly can. He can still serve, and I encourage people, order a bottle of wine off him, order a bottle of spirits or some beer off him, go order takeout. The public can help tremendously with these restaurants. We're having these bubbles. Someone came to us the other day about putting these bubbles. I don't know if you've ever seen those clear plastic bubbles you can go in outside. It's not the full solution, but it's another tool that they can use. And we got that approved through our health table. Bounced it off the Meritori as well, that's working with restaurants and being understanding. So we're doing everything we can to help the restaurants.
Follow up.
I wanted to, Premier Legault today says that Quebec, he's not seeing a dip. They're ahead of us in terms of their second stage or their modified shutdown in Montreal and Quebec City, and he's not seeing enough of a dip down. I appreciate we're behind them. There's still a few more weeks to go. Are you seeing enough that there's light at the end of the tunnel on 28 days, or are we is it too early to say?
Well, I wish I had a crystal ball to find out where we're going. You know, I pray in a couple of weeks things are going to change. I pray every day that the numbers are going down. I get these numbers. First thing I do is look at the cases and I break it down to regions. So the more we all work together, we follow the guidelines and the protocols, we'll be able to get through this. And Premier Legault, he's working very hard. He gave us the utmost compliment saying, hey, I wish I had the secret that Ontario has. So everyone's pitching in and doing their very best. And I want to wish my friend Premier Legault all the best, because he's in a battle right now with COVID, as we all are.
Next question.
from Cynthia Mulligan at City News. Please go ahead.
Hi, Cynthia.
Hi there, Premier.
Hi. How you doing?
I wanted to ask you about Charles McVety. Is his college getting university status a tit for tat? I mean, he helped you get the leadership and he helped you win the election.
Well, I'll disagree on both comments about helping get leadership. I have supporters across the province, and as for the election as well. Mr. McVety is going through the same process of every single other university in this province, and many of them gone through it. He's going through it, and it's an independent process, and we'll see what happens.
Follow up.
Well, it certainly looks like the days when your government was embroiled in patronage scandals not so long ago. Former Premier Kathleen Wynne stood in the legislature and was very vocal about a man who has expressed such anti-homophobic views as getting a university. What do you have to say in response to the former Premier, who you yourself just stood and lauded in the legislature this week?
And I'll applaud her again, the first gay premier, and congratulations. I think that's fantastic. First woman premier. But let's keep in mind, the Canada Christian College has been open for 53 years under her term, under the Liberals for the last 15 years. So it's going to go through the process, and we'll see what happens.
Next question.
From Haley Cooper at News Talk 1010. Please go ahead.
Thank you very much.
Hi, Haley. How you doing?
We wanted to ask you about the pilot program just announced for Calgary Airport and the land crossing in southern Alberta, where international travelers will have the option of being tested at the border, and if they test negative within 48 hours, they won't have to quarantine. We know that Toronto Pearson was considered to host the pilot project too, so we wanted your thoughts on the project, and at any point were you presented with the pilot and ultimately decided to reject it?
Yeah, Haley, great question. I've been all over this. I've been talking to Premier Kenney about it, and he had the conversation with the other premiers and the Prime Minister. We're keeping a really sharp eye on what's going to happen out in Calgary on this pilot project, and I'd be open to it, but I just first want to see what's happening in Calgary with it, because Toronto is much different than Calgary. Calgary, it doesn't get the volume, number one, but doesn't get the diversification around the world. Everyone lands in Toronto, but I've been on this from day one of this pandemic. We should be testing people right as soon as they get off that plane. Now, the game changer is the rapid test that we have with Abbott and giving us 100,000 kits. I think that's great, but those kits, they're going to go to high priority areas, congregate living facilities, long-term care, First Nations up in the north that they need to see results right away. But this is what we've been waiting for. And I'd do it in a heartbeat. We want as many tests from Abbott as we can get our hands on, so we can get the results in 15, 20 minutes for people. This is a game changer. It's not everything, but it's a game changer.
Next question.
My follow-up is actually about the rapid test that Ontario has secured. You mentioned 100,000 of them, and that some of them will be going to rural Ontario and northern Ontario, but there are very few cases there. So wasn't the point of the rapid test to distribute them in hotspots to cut down on the backlog?
Well, we want to cover quite a few areas, and 100,000 is the first shipment. I want to see millions of these coming to Ontario, and I don't want to toot my own horn, but I'm going to. I've been pushing Health Canada like no other premier, no one else in this entire country. Finally, we're seeing results, and thank you, Health Canada, for listening. They're working hard, and I just need more kits from Abbott, and I know Roche, they're putting stuff together, and other pharmaceutical companies. So we need as many as possible. Because I'm such a strong believer. This is going to be a game changer. And as for your question about going up north, there's a lot of First Nations communities. If COVID starts spreading, they're going to be in deep trouble up there. So we want to make sure that we get the test results immediately. Sometimes they were waiting 4 or 5 days. It had to be flown in some cases up to Winnipeg and waiting for results. So we want to take care of the First Nations community, people up in the north. And of course, number one priority is long-term care, congregate living facilities. And that's where we're going to roll them out first.
Next question.
From Jeff Gray at the Globe and Mail. Please go ahead.
Hi, Jeff.
Thank you. Hi, Premier.
Hi.
I wanted just to go back to a technical point about the Canada Christian College.
Sure.
You said, I think you said yesterday that they had completed the process. Now.
Yeah, and I apologize, Jeff. You're 100% right. They're going through the process, so I apologize. I thought they had completed it. I looked into it, and they're going through the process.
And that question would be then, why, if they're still in the process and they haven't gotten this minister's consent that they need, why is there a bill before the House already that presumes that they've gone through the process and they've gotten approval?
Well, it doesn't say they're got approval already, but they're going to go through the process like every single other person. And I'm not going to treat them differently than anyone else. They've been around for 53 years, and they're going to go through it. And let's see what happens.
Follow up.
Well, why not wait till the minister has approved it and then have a bill go before the House? Why is a bill before the House now when the process isn't complete, I guess is the question. People would say, is that special treatment then for someone who was a supporter of yours?
No, not at all. They're going to be treated the same as every other college, every other Christian college, to be more precise, and other colleges that have applied for this. And let's see what happens. We'll move through this, and they'll go through the proper channels like every single other college has.
Next question.
From Sean Jeffers at the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier.
Hi.
Premier, I wanted to ask you about your comments yesterday about the insurance industry. They were very brief, and I'm hoping you can expand on them. You said you were firing a warning shot at the industry because of rising rates and complaints that you're hearing. Now, I spoke with MPP Jim Wilson, who's been in the legislature for decades, and he said that no government that he's seen has really had the political will to take on the insurance industry. What are you willing to do to address this? Are you willing to regulate the industry?
Well, you just got a message again from the insurance companies. I just get fed up of hearing these stories. I'll give you an example, banquet halls that can't get insurance, or they're charging hundreds and hundreds of thousands of dollars, or stories of stores not being able to get insurance. I'm fed up with these guys. They're gouging the people and made a fortune over all these years. And I've just had it with these insurance companies. They need to come to the table, start supporting people, insuring. They're absolutely just refusing to insure people. Like, we don't play that game. You don't get, by the way, the insurance companies, you guys don't get to get all the cream and gravy and the whipped cream and just slough off everything else and think we aren't going to insure it. So I'm working closely with our finance minister, and I'm onto these guys. And as for Jim Wilson, this guy has political will. I can assure you that, because I'm going to protect the people. The people are the priority, not the big insurance companies making gazillions of dollars. So I'm coming. Just I can assure you I'm coming.
Follow up.
And Premier, back to the liability legislation that was introduced recently. I'm wondering, is there a specific reason why the long-term care sector was excluded from this legislation, or was not excluded rather from this legislation, why they were not set aside? Are you afraid of the impact that lawsuits will have on the sector? You were trying to build beds. You were trying to respond during the pandemic here. Is there something that we are missing here?
Well, I'll answer this, and I'll try to put it to bed. Number one, it's about transparency. When we first got that report from the military, I immediately, first word out of my mouth, and I even confirmed with my chief of staff, was I want this public. I want it public tomorrow morning. And then we have to take action. We took action immediately, making sure that we had the inspectors go in there to inspect it. I didn't hesitate to shut them down and take them over. I think we took over well over a dozen, or probably even higher than a dozen. We moved in there. We have the ombudsman report. We have the attorney general's report. We have the commission as well. And if there's police have to do investigation, God bless it. But I can tell you what we are going to do. As sure as I'm standing here, there will be justice against the bad actors in long-term care. And there wasn't, keep in mind, I think there's 626 homes, and they weren't all. I can't paint a broad brush. And I will not stand here and protect these big companies that acted recklessly and carelessly. There will be justice for the families that have lost loved ones. And I'm not going to exclude one group from the other. We're going to make sure they're held accountable. But we have to see the commission's report and the ombudsman's report and I said Attorney General, I meant Auditor General's report as well. And then we'll take action. But I can tell the families there will be justice. My mother-in-law is in a long-term care home. I've been up there just hammering away, making sure that these long-term care homes, which, by the way, we inherited an absolute disaster. We're the only government in 30, 40 years that are actually moving forward and building new long-term, rapid build long-term care homes. And thanks to one of the reporters asking me about air conditioning, we're putting air conditioning in. We have more inspections happening. They're being held accountable for the first time in 30, 40 years. And I will not stop until these families get justice. Simple as that. And that's what's going to happen. They will get justice.
Next question.
From Lena Latafat at CP24. Please go ahead.
Thank you. Hi,
Hi,
Premier.
Lena. How you doing?
Tomorrow marks 2 weeks since Toronto, Peel, Ottawa were all moved to a modified stage 2. We're pretty much at the halfway mark now. Do you have an update on what happens after the 28-day period is over in about 2 weeks' time? And I also want to ask you how concerned you are about Toronto's positivity rate recently hitting 4.4%.
I'm super concerned about it. I look at these numbers every single day, and I just wish again, when I could tell you what's going to happen 2 weeks down the road. I really hope, that we can bring these numbers down, but people have to follow the guidelines. That's the best way to do it. Work together, and then we're looking at the, excuse me for saying this, but everyone calls it the poop report, measuring each of these cities. And we saw actually in Ottawa, we saw it go down a little bit. So that's good as well. But I'm concerned. I am definitely concerned. And these are the reasons we have to take these steps and put these guidelines in.
Follow-up.
Premier, Minister Elliott has said there is no flu shot shortage in Ontario, that there is good supply. But we keep hearing from viewers, a lot of seniors who say they still can't get the high-dose vaccine. Some people are still on wait lists. Why would you, as Premier, not anticipate this kind of demand at the beginning of flu season? And what is your advice to these people?
Well, the advice that the minister gave is just call ahead. We have 5.1 million doses, which exceeds by far the previous year's dosage. And we're on to the pharmaceutical companies. I will get an exact time when we can get it in the rollout. I know it's out there right now. Just watching TV, I saw the mayor actually get the flu shot and the minister. So I'm going to find out the exact date. And I fully appreciate your question. I'm a numbers guy. I will have the answer tomorrow. The exact numbers. What do we have? When is the balance coming? And because I share your frustration sometimes when I hear this. There's a million moving parts. I just want to get answers. Very simple. I will have your answers tomorrow on the exact numbers we have and when the balance is coming in and where the distribution is. And I want to thank you for that question. It's an important question.
Last question.
Joanne Chanello at CBC Ottawa. Please go ahead.
Hi, how you doing?
Hello, hi, Premier. I'm calling. I'm wanting to ask about a local issue here in Eastern Ontario. The Eastern Ontario Health Unit was looking for some modified stage 2 restrictions. They wanted to go back to some stage 2 because they're finding they're having higher COVID rates. And are you going to bring those in for, I believe the cabinet was talking about that either today or yesterday. And are you going to bring in some restrictions for Eastern Ontario? Thank you.
Thank you. And thank you for the question. As I've always said, each chief medical officer can pull section 22. I know there was a couple regions that were saying we couldn't do it. Well, the proof is in the pudding. Yesterday, London did it. So they can do it. And that's pretty well settled. If they want to do it, have a modified stage 2, we rely on the information that they have. And by all means, if the chief medical officer puts a section 22 in, we will respect that, as we have with London. And that goes for other regions. And I'm gonna tell you, sometimes I feel like some regions want to pass the buck, and I'll be the bad guy. I have no problem. I'm the premier. I'm responsible. I'll be accountable. But some regions pass the buck and say, no, you do it. I don't want to be the bad guy. Well, fine. That's fine. But I give London credit. I want to thank the chief medical officer out there. I want to thank the mayor, which had a great conversation the other day with him, for actually standing up and doing the right thing, and not always, going back to the province and let them, make the announcement. I don't like making those announcements, but I'm the premier. It's my responsibility. I take full responsibility, and I will do it. But the regions that want to hide around and do it, why don't you just come out, and if you have an issue, issue the Section 22, and we'll respect that Section 22 order.
Follow-up?
Premier, on that, sorry. And is it, sure, Section 22 exists, absolutely, but the province brought in restrictions for Ottawa.
Yep.
We're right next door to Eastern Ontario. I think, are looking for some provincial restrictions as well. So why do it, why bring in the provincial restrictions for Ottawa, but not Eastern Ontario?
Well, there was huge difference with Ottawa and Eastern Ontario. The numbers were drastically different. Ottawa was going over the cliff, and thank God that we did it. And by the way, the health table and Dr. Williams is in constant contact, and his team, with all chief medical officers, all 34 of them across the province. And at the time, it didn't justify it. It didn't justify making the move. And I'll give you an example. London the other day, I have to check the numbers of yesterday. I think they went up 7, but they had 3 cases in population, with a whole area of close to 500,000 people. And I respected the fact that the chief medical officer went out there and said, I want to do modified stage 2. I will do the same. And I know the chief medical officer will do the same for Eastern Ontario. And if they can justify it, by all means, do it. But right now, there's night and day comparison between Ottawa and Eastern Ontario regions.
Thank you, everyone.
Thank you, everyone. Take care.